Recognize the gentlelady from North Carolina, Ms. Ellmers, 5 minutes for questions.
Thank you, Mr. Chairman, and thank you to our panel. Dr. Niloff, I'm going to direct my question to you in the interest of time. We were just discussing, kind of following up on some of the discussion. We're talking. I certainly see all the benefits to patients on health IT. This really is an area that of obviously much need into the future. But there again, keeping in mind that we know that there are all the positives, what are the barriers? And I think we were just talking about some cost issues here for integrating the systems. Do you see this as an issue too, and are there other barriers that we need to be aware of?
Sure. So I think that the main barrier and the main challenge today, as we've discussed, is interoperability and continued innovation. Mm-hmm. And I think that we need to have the right payment model in place to drive the purchase of these systems. We need our delivery systems to have sufficient alignment of their different contracts that they're operating under. Mm-hmm. So they're doing population health, coordinated care on a significant portion of their population, that they can make the investment both programmatically and technologically in these type of things, because that will drive innovation as the market grows.
And when you say they, are you talking about the physician themselves, or are you talking about?
I'm really talking about at the health system level. Okay. I think much of this technology, because physicians are now working in organized systems of care, mm-hmm. where they're part of an integrated network, and we're really driving to coordinate care from the inpatient arena to the outpatient arena to long-term care, mm-hmm. that really what we're talking about is health systems making purchases of technology, and not just electronic medical record technology, but enterprise registries to drive preventive care and manage patients with chronic illnesses, care management systems where they use technology to identify high-risk patients and then have skilled nurses manage those patients. Mm-hmm. That those are the types of technologies and related programs that are ultimately really going to drive us to a delivery system which is going to drive real improvements in health.
So that would be, too, just actually playing into another question. So I'm just assuming that that's kind of the path that you see us taking as we're looking for the 21st century cures, and how we as legislators and how we in Congress can help that effort. Obviously, you see that as an effort too when we're moving towards advancements in medical technology and curing disease and moving forward that way. Is that?
Yes. I think that it would be helpful if, as Congress considers sort of healthcare for the 21st century, that they think about healthcare in the context of not how we're delivering care today, mm-hmm. but in a framework that thinks about the context of how we're going to deliver care in the future in a more optimal model. Mm-hmm. Think about how we're going to have systems of care where everybody talks to each other, where when a patient moves from the hospital to a skilled nursing facility, their record moves with them, and it's not, it's not, I'm thinking about a family instance, but where, an 80-some-year-old mother ends up having to be the major coordinator of care, mm-hmm. for her 93-year-old husband because it's not happening electronically and the health system can't manage it. And I think that's really what we have to think to is what sort of care model, system of care, mm-hmm. that we're going to move to that makes it not just better care but better experience for patients and families, mm-hmm. and how Congress can modify law to drive that type of system of care which will benefit all Americans.
Thank you, Dr. Niloff, and thank you, Mr. Chairman. I yield back the remainder of my time.
Chair, thanks.